Well, good afternoon, everyone. Thank you for joining us today. As usual, we have Dr. Morrison with us, our Chief Public Health Officer, to provide an update on COVID-19. I want to start by extending my heartfelt sympathies to the two families who lost a loved one related to COVID-19, announced last week. This is our first briefing since then. This news certainly wasn't easy to hear for anyone, and I'm confident when I say to these two families that you do have an entire province grieving with you. So just want to extend our sympathies in that regard. Today we have news that is more difficult to share again, and that is that we have new hospitalizations and new ICU admissions, and we know that this Omicron wave needs to be slowed as much as possible to preserve our healthcare system, to get our children back to school and get our way of life back to some kind of normal. Last week we talked to you about some of the indicators that we would be watching, the 7-day rolling average of cases, the number of hospitalizations, the number of ICU admissions, and right now each of these are trending in the wrong direction. We had hoped that the restrictions that we had in place would be enough for us to slow things down, but it does not seem to be losing steam here, Omicron. And as we said last week, even though we all want to be done with this, COVID is not done with us, and we have to deal with that reality. Our restrictions have always been about trying to help support our healthcare system, but slowing down the number of admissions to hospital, to allow more people to get their booster shots and their vaccines, and those restrictions have been strict. But with that being said, with what we're seeing and what our modeling has been showing us, we will be introducing some new restrictions today that will remain in place until January the 31st. Dr. Morrison will share those with you in depth. These aren't easy to put in place. For months we've been talking about seeing the finish line, and it's painfully obvious to us that it is in our view. But it's also frustrating to know we can't seem to get there as quickly as we would like or want to. The Omicron has brought with it a fog that has made that finish line hard to find. And we need to do whatever we can do to slow it down until that fog lifts. Based on the trend lines, Dr. Morrison has made these recommendations to Cabinet this morning, and they have been accepted by the provincial Cabinet. She will outline these new restrictions, which we know will come with mixed emotions from many of you, but it is what we need to do right now to buy us some more time, and it's based on the best data we have today in response to trying to make it a little bit easier and better for tomorrow. In response to these restrictions, two Cabinet committees have been struck, one on our social response, one on the economic and government operations response. And they're charged with ensuring that we do everything that we can do to support islanders during this time. And this, we know the difficulties the next couple of weeks may bring. These two Cabinet committees will be meeting daily to assess the impacts of these restrictions on islanders. And as I say, do what we have done from the beginning, which is trying to be there as much as we can for as many islanders as we can for as long as we can to get us through this pandemic. I do know and appreciate there are mixed emotions out there. As you can appreciate, there are mixed emotions right here at this table. Nobody has been more hopeful than myself and Dr. Morrison that the worst of this pandemic was behind us, but we have to deal with the reality that we face, and what we're looking at right now is a very disturbing and unnerving trend that we need to do everything we can to try to flatten. We're using the same consistent approach that we have used from the beginning, following the evidence and following the advice of our Chief Public Health Office. That's exactly what we will do until the end of this. But that, I know, that certainly does not make the news today any easier to hear or any easier to deliver. But with that, I will turn it over to Dr. Morrison for her overview on COVID, as well as the restrictions that we have agreed to put in place, and then we will open up the floor to questions from our friends in the media. So over to you, Dr. Morrison.
Thank you, Premier. Good afternoon. And I'd also like to start by extending my condolences to the families of the two individuals who died with COVID late last week, and it was really heartbreaking for everyone involved. So our condolences. And as the Premier mentioned, I'll speak really today about the situation here in P.E.I. and the measures, and then also mention information about accessing positive test results online. As of 8 o'clock this morning, there are 407 new cases of COVID-19 to report, bringing our total active cases to 2,214 and 4,808 since the pandemic began. Over the last 7 days, we've had an average of 231 cases per day. There are 8 people in hospital being treated for COVID-19, including 4 people in intensive care. In addition, there are 3 people in hospital who are positive and are being treated primarily for illnesses other than COVID-19. Our numbers, as the Premier indicated, are really going in the wrong direction, and we are facing a serious situation. We've all been doing our best to contain the spread of COVID-19, and while it is helping, and I believe our current measures have helped slow the spread, we are experiencing trends that are very concerning. For example, our 7-day average of new cases is rising. The percentage of tests that are positive is almost 20%, a rate that confirms we have a very high incidence of COVID in our province. The proportion of cases that cannot be linked to travel or being a close contact has increased to 31%. Almost 1/3 of our cases are of unknown origin and are considered community spread. There are 3 new facility-based outbreaks to report today, and our hospitalizations, including ICU admissions, are increasing. So we need to take further steps to limit contacts between individuals. Throughout the entire pandemic, we have been guided by the local information we have at hand and the evidence and the science. We have benefited from going hard and fast when there are indications to support taking additional steps to curb transmission. We know that none of these decisions come without impacts. I had hoped that we would never be in a situation where we would have to implement even further restrictions. However, given the situation we are in, the best option is to do so. Effective at midnight tonight for a 2-week period ending on January 31st, the following additional measures are in place. Personal gatherings are limited to a single household plus up to 2 other support persons where needed. People who live alone can join another household. Single households may participate in outdoor activities such as snowshoeing, skiing, skating, or hiking. No organized gatherings are permitted. Funeral and wedding ceremonies are permitted with up to 10 people plus officiants. Gyms, group fitness classes, and all indoor recreational facilities are closed. There will be no in-room dining or services at eating establishments or licensed premises. However, takeout, drive-through, and home delivery are permitted. Public and private schools will be closed to in-class learning until January 31st. Respite programming can continue at schools. Retail will remain at 50% capacity with physical distancing. Visitation at long-term care and community care facilities will continue with the following specifications. In facilities where there's not an outbreak, 3 partners in care can visit their loved ones. In facilities where there is an outbreak, only 1 partner in care is allowed to visit. Residents are not permitted to go on community visits unless it is for essential purposes, including medical or dental services. Isolation measures at our borders will continue for 4 days with testing. Discussion will occur hopefully later today with the early learning sector to discuss further measures with them in consultation with them. As we have said before, we cannot stop Omicron. The best thing we can do is to slow it down and try to flatten the curve. And we've talked about that really from the beginning of this pandemic. We've had measures in place to help slow the spread and attempt to reach a balance, with the least intrusive measures to keep the burden of disease and the demand on the health system at manageable levels. Now is the time to increase our measures in order to balance taking steps to protect those who are most vulnerable to severe outcomes and support our hospital system. We need time to reverse some of the trends we are seeing, and we can do that by limiting our contact with others. I realize it is not easy for many islanders to hear about these increased measures until the end of the month. If we see positive indications that our trends are going in the right direction even before that time, we'll ease some of these measures before the 31st. The reality is that when we are out and about in the community, we should be prepared that we may contract COVID-19 regardless of our age. In addition to following the new measures, we have a personal responsibility to protect ourselves and others, and we all need to do our part. This means we should get vaccinated, including a booster, wear a good quality mask properly, limit our circle of contacts and social activities, and stay home from work and activities if we are sick. In terms of outbreaks, I can provide an update in that there are 3 new facility-based outbreaks under investigation: the Provincial Addictions Treatment Facility, Bevan Lodge Community Care Facility, Andrews of Park West Community Care and Long-Term Care Facility. And of course, I'll just list the other facilities where we had previously announced: Garden Home Long-Term Care Facility, Atlantic Baptist Long-Term Care Facility, Miscush Villa Community Care Facility, Provincial Correctional Center, St. Eleanor's House, the population that accesses shelter and outreach services, and early learning childcare centers. And there continue to be outbreaks in various workplaces throughout the province. Since September of last year, individuals have been able to access their negative test results online through My Test Results page on the provincial website, and that's actually since September 2020. Now, people who check their test results online will also be able to see if their test result is positive, meaning they will know their COVID-19 status much sooner. The results will be posted online within 4 to 24 hours after the test is completed. If you do not have access to a computer, you can call 1-833-533-9333 to get confirmation of your COVID-19 test results. Please be patient, as the staff working on that call line are working as fast as they can to respond to inquiries. As I've mentioned before, the capacity of our office and public health nursing to contact all positive cases in a timely manner has been exceeded, given the number of new cases each day over the last few weeks, including over 400 today. Beginning today, individuals over the age of 50 years of age who are positive will be prioritized for public health follow-up. If you are named as a close contact or have symptoms of COVID-19, you should not leave isolation until you receive confirmation that your test is negative. If your COVID-19 test is positive, there will be important instructions on the website for you to follow, including information about self-isolation and identifying and notifying your close contacts. If you test positive, all the information you need can be found at princeedwardisland.ca /tested positive. Being vaccinated, including getting your booster when you are eligible, is our best protection against Omicron. Hospitalizations for serious illness related to Omicron variant are disproportionately in individuals who are not fully vaccinated. As of Saturday, January 15th, 96% of Islander residents over the age of 12 years have received at least 1 dose of vaccine, and 92.7% were fully vaccinated. 57.9% of children aged 5 to 11 have had 1 dose, and over 38,500 individuals have had their 3rd or booster dose. Approximately 23,500 people are eligible to receive a booster that have not done so. This is too many people at risk of needing hospital care. Getting a booster helps to protect you and your family. 70% of people eligible for their booster are 50 years of age and older, a group we know the evidence shows has higher risk for severe outcomes and hospitalizations. If you are over the age of 50 or immunocompromised, your risk of needing hospital care is greater. If you're eligible to receive your booster, please make an appointment. Individuals who have been diagnosed with COVID-19 still can get vaccinated, including their booster. There are a large number of appointments available for people in P.E.I. to get a booster dose in the coming weeks at pharmacies, at health P.E.I. clinics, and at the Canadian Health Lab clinics. If you need help to book a vaccine appointment, please call the vaccine booking line. It has now been 8 weeks since we started immunizing children aged 5 to 11 against COVID-19. This week, those children will begin receiving their second dose of vaccine. The offering of COVID-19 vaccine in schools is postponed. Parents are encouraged to book their children into a public health nursing clinic for children aged 5 to 11. There are appointments available for this age group in O'Leary, Summerside, Charlottetown, Montague, and Surrey. Parents and guardians can call the vaccine booking line to make an appointment, or they can choose to book online. Clinic days for children are highlighted in orange when you're online. I urge parents that have not done so already to please make an appointment to get your child immunized. Appointments are available in all parts of the province. If your child is afraid or anxious about getting vaccinated, please let the clinic staff know that your child needs additional support. Public health nurses are experts in giving immunization to children, including helping to allay fears. We are seeing unprecedented spread within the province from COVID-19, and we are at an important fork in the road with this wave. We hope we are near the peak of this wave. However, we do not know for sure. It will be another week or two before we know much more about the impact of this wave, including the implications for the healthcare system. We have to remember that even the downside of this curve will be considerable in terms of half the cases that are still going to happen after the curve that happened up to the peak of the curve. Our public health system is strained to manage the volume of new cases and the numerous outbreaks in high-risk settings. In addition, there is strain on testing clinics with high demand, while staff in health P.E.I. and in community pharmacies are working tirelessly to vaccinate thousands of people each week. Some of our colleagues in long-term and community care are managing outbreaks, and many are dealing with staffing challenges related to COVID-19. Staff in the hospital sectors are caring for people who require hospital care and preparing for the possibility of increased demand for acute care related to this wave. The Omicron variant is affecting all aspects of life in P.E.I., and we all want this to be over. Every single one of us is tired and COVID weary. There will be a few more bumpy weeks of an intense COVID activity. We need to do our best now to limit the size and impact of this Omicron wave. I am optimistic that once we get through the next few weeks, things will be better. And after a tough winter, we will have a better spring. In the meantime, we need to focus on getting as many people vaccinated, complete with their booster. While our high rate of vaccine is helping to minimize serious illness among the thousands of islanders who've contracted COVID-19, getting a booster is really essential to maintaining protection against serious illness and hospitalization. As we get through this one day at a time, one step at a time, let us continue to be patient and kind. Thank you.
Thank you very much, Dr. Morrison. And like many of our most recent briefings, there's a lot to unpack here, so we'll try to be as accommodating as we can with our friends in the media to provide as many answers as we can. But let's start with Julien, Radio Canada.
Sure. Bonjour. Good afternoon to you both. I'm going to ask the question in English, so you can feel free to answer in French and English, please. Simple question. Why now you put in place those restrictions? Why you waited maybe a couple of weeks? Do you think it's a little bit too late, or today is the right time to do it?
I think hard decisions are going to be hard whenever you make them. I actually think it's important that we make the decision based on the information we have. And we know a lot more today than we knew 2-3 weeks ago about Omicron, the effectiveness of vaccines, not just here, but across the country. So we have learned more now. And I think I mentioned that none of these decisions are without impact. So we need to make the best possible decision with the information that we have. And we now have trends from the last couple of weeks, and these trends are on all our indicators. So we aren't looking just at one day. We have information that gives us that information. I'm sorry, Julien, j'ai pas parlé en français, mais si je me souviens qu'est-ce que j'ai dit en anglais, mais pourquoi maintenant? Alors, on a plus d'informations aujourd'hui qu'on a eu il y a 2-3 semaines. On a les indications qui sont pas seulement en journée, mais on peut regarder quand même le trend qui continue pendant 7-14 jours. Et puis, en plus de ça, on sait on sait plus à propos de Omicron. Pas seulement ici à l'île du Prince-Édouard, mais partout au pays. On a notre propre évidence à part de Omicron qui est à propos l'effet du vaccin, qu'est-ce qui arrive autre partie du pays. Alors, et chaque décision, on sait d'autres impacts. Alors, c'est une balance, mais je pense que quand on regarde, on a l'information aujourd'hui, on ne veut pas attendre, on fait la décision aujourd'hui.
I would just add, if I could, Julian, that I think part of the whole job, I guess, that Dr. Morrison and I find ourselves in, but I think you ask yourself every day, is this the right time? Is it enough? Can we do more? And I think we ask those questions regularly. Dr. Morrison and her staff have been consistent with their advice. We were pretty strict with our protocols to date, and herself and Dr. Cameron, our epidemiologist, would say that a lot of the protocols that we have in place have allowed us to sort of creep as we have. Although we're trending in the wrong direction, it's probably slowed the creep. They came into my office today and said that the information that they're looking at is troubling, and they request to go further, and that's what we have done from the beginning. But look, I think you always, if you're human, you look at these things and say, could I have done more? Should I have done more? I think that's human nature. I think we've tried to be consistent from a government perspective, to take the public health advice, to look at the data, and to act accordingly. And never once have we not acted. And today we were presented with this, and cabinet met and talked, and we accepted the recommendations, and here we are. But I think absolutely, it's human nature. I think Dr. Morrison would concur that you always look back and say, could we have done something here? Did we go too fast? Did we not go fast enough? I think that's the human nature component of this. But when you live it in real time, it presents a lot of challenges. And I say that consistent approach that we've had has served us well, and I hope it continues to serve us well. But it's safe to say nobody wants to shut down. Nobody wanted to get to here. And we really, really were hopeful that the measures we had in place were strict enough, but we're just seeing, transmission at a rate that's troubling, and we need to act, and we have.
My second question will be related to the death of the two people last week. Do you really think it's a game changer for P.E.I? You spoke both together about the trends. We see the trends is going up. But do you think the death of those two people was something you say, okay, now it's the time to do it, it's the game changer?
Maybe I'll answer in English first. I think when we look at severe outcomes, that includes our hospitalizations, our ICU admissions, and our deaths. And so it's part of that whole picture of of worsening severe outcomes. And so I think it's part of that, the concerning trend of severe outcomes. And so I'm not sure if it's all any one particular thing, but it's part of that bigger picture. And alors en français, c'est vraiment quand on regarde qu'est-ce qui arrive quand les personnes arrivent à l'hôpital, ils sont intensive care, sont les morts. Alors, c'est tout ensemble. Et quand on regarde le nombre qui augmente dans tous ces cas, ça nous donne la peine. Et puis, on veut que personne soit malade. On veut que personne a des résultats, des outcomes comme ça.
I just, I think that the unfortunate news on Friday, is extremely troubling for anybody to hear. From a provincial perspective overall, we had done extremely well, and we never had the extent of COVID that other jurisdictions have had. And we had never had to deal with the reality of what COVID can do. And I think, I don't know if that changed much in terms of the decision making, but I think, and I certainly feel that it brings home to P.E.I. the severity of what we're dealing with, and why we've acted as we have to the extent that we have over the last couple of years to try to limit the transmission, because for a lot of people, COVID might not be a serious illness, but for far too many islanders, and none that I would ever deem to be expendable, COVID is a death sentence for some, and that's what we've been trying to avoid. When we see high rates of infection, we know that's going to lead to hospitalizations, and the inevitable could be worse. And that's why we've acted the way that we've had all throughout this. But I think those unfortunate losses on Friday should hit home for Islanders, the severity of this, and why we're acting the way that we are, and trying to do everything we can to get through it safely and as fast as possible.
My last question for you will be about the restrictions. You just announced a lot of things about restrictions. How it's going to work for you in the next 2 weeks? You're going to look like the trends, and like in 2 weeks we're going to be back here. You're going to say like, we are continuing that for another 2 weeks. We are ease the restriction, or do you have already in mind like it can be worse? You can input more restrictions in 2 weeks.
I mean, I'm hopeful we don't need to put any more restrictions in place. I think if we know if we can decrease our contacts by a certain percentage, then it should limit the transmission and reduce the spread of COVID-19, which then ultimately will hopefully level off the cases, which will, I mean, the lagging indicator, it's a hospitalization, so sometimes that lags behind in terms of the numbers. But if we can do that, then we would anticipate when people go back to school and we start to ease up these measures, there will be an increase again of cases. But we know we need to be able to handle that additional increase when that happens. So we certainly don't want to open up schools for in-class learning while we're still on the upward trend. We need to be able to make sure our health system is in a position that can still, deal with the hospitalizations that are coming in. But based on what we're looking at in this province and across the country, I certainly hope that we're easing up measures in 2 weeks. Yeah. Et en français. OK. Alors, en 2 semaines, j'espère vraiment quand on voit le nombre de cas qui sont plus stables, ce qui diminue un peu. On sait que des fois, c'est les personnes à l'hôpital qui vont continuer un peu plus après. Mais on sait que si on réduit le nombre de contacts qu'on a, on diminue la chance de transmission. Alors, ça, c'est l'évidence ailleurs nous montre aussi. Alors, j'espère qu'entre 2 semaines, on est ici et puis dit, OK, les insulaires, si on fait ce qu'il faut, on fait le meilleur possible, on peut voir une différence.
Merci.
OK, thank you.
Allison from The Guardian, maybe?
Yes,
Proceed.
Alison Jenkins, The Guardian. Wondering if you can, for Dr. Morrison, give me a breakdown of the folks in hospital, just age ranges.
I didn't bring all the age ranges here, but they're all on the website this afternoon, the age ranges of everyone in hospital in sort of 80 and above. I think it's 60 to 79. So they're broken down, but they're all will be on the website this afternoon.
Okay.
But there's a wide. I know that there's less than 12 to 80 and above. So it's wide ranging.
Okay, and so I was wanting to ask about the rumors of a child in the hospital for that. What is there anything special that they need? You know, are we prepared to offer care for an under 12?
Yes.
Premier King, you had mentioned there's 2 new committees getting struck. I was hoping you could elaborate on what they'll be rolling out soon.
Yeah, I think what we're trying to just look at is knowing that there will be lots of islanders impacted, whether you're a worker, a family member, a business owner. There's going to be impacts here. So, way back when we began, we sort of just tried to make sure we were dealing with this and trying to answer as many of the questions that people have and respond to the extent that we can. So we know there's going to be challenges with childcare, and we're having a conversation with that sector later today to make sure we're responding to the extent they would need us to, and just the overall economic pressures. From a government operations perspective, I kind of made the comment today that I still see too many cars in the government parking lot. Most people are working from home, but there seems to be more people in here working now than when we did this originally in 2020. So we're just trying to take a look at that. But it's really just to look at our COVID response and trying to make sure we're as robust as we can be and to answer the needs that everybody has. So our cabinet has been working around the clock on this from the beginning, and it's just, they look at it from a departmental perspective, but now we just brought them together. So we have 2 cabinet committees. One is what we call CCOP, and the other is Treasury Board, and we just delegated some duties to both of those committees for the time being to make sure we're answering as robustly as we can the needs of Islanders.
Okay. I have a third question. You said there were some workplace outbreaks. Wondering if one of the workplace outbreaks is at the legislature.
I've heard that, but I don't know if
Yeah.
Dr. Morrison has that completely.
Yeah.
But I have heard that there are some staff, et cetera, around the Coles building, but I don't know if that's confirmed as an outbreak.
I mean, we actually don't usually identify the workplaces if they're not public exposure places.
bad,
So,
yeah.
and that's sort of been our practice throughout the. We certainly at outbreak settings that are workplace, we'll give advice and work with the owner or the responsible. But we talk about publicly where there's interaction with the public if there's an outbreak.
Okay, thank you.
Thank you, Allison. Now we go online for some questions.
Tracy Lightfoot, CBC. Good afternoon. Just wondering if you can expand a little bit more on the meetings that are going to be taking place with early learning centers. You mentioned that you're going to be discussing more measures as a possibility with them. What kinds of things will you be looking at as a possibility in order to increase safety at those centers?
You want to Sarah, maybe?
Sure.
Yeah, sure.
I mean, hi, Tracy. Nice to hear your voice. I think we have been in communication, certainly. I know the early learning sector has had town halls and other virtual meetings. There's been updated guidance. They've tried to answer a number of their questions, but given all the other measures, I think it would be important to have a sort of consultation, further discussion with the early learning sector, which we didn't have a chance to do before we came out today. I mean, I think the questions around it's always a challenge. This is a group of young people who can't always wear masks. They can't physically distance in the same way. The distribution of antigen tests have gone out for staff and children. That they started being distributed yesterday across the province for the different facilities. And I think one of the things they would like to discuss is capacity limits. But of course, that has big impacts on families as well. So I think there was certainly, and I think the Premier and I both would like to have a further discussion with before we would make any announcements around that.
Yeah, I don't have much more to add than that, Tracy, but I mean, that's just the, so many people have been the champions of COVID, and those in our early learning centers have been at the top of that and have shouldered a lot of the responsibility, and we just wanted to make sure we're trying to respond to what they need. We will look at trying to do some reductions to the best we can and the best that they can accommodate. And we just felt, going through what we're going through here, that it would be important for us to hear from them what they need, as opposed to us putting some restrictions in place that, weren't as well thought out or well, described as they could be. So we'll definitely be announcing some changes to the early learning centers tomorrow or as soon as we can. But we want to make sure that those who work in the industry have as much input as possible.
Thanks very much. You mentioned the antigen tests there that have gone out to early childhood centers, and I know a lot of the test kits have gone out to schools as well for when they come back into session. What about folks who don't have kids at early childhood centers and don't have kids at school, but have a symptom and would like to test themselves at home rather than tying up resources at the clinic? Where can folks like that get rapid tests at the moment?
Well, Tracy, I know we've had on some of our previous briefings quite a bit about rapid antigen tests, and I think it's important that at this point in time, the recommendation still, if you have symptoms, the best place to get tested is at a testing clinic. We're running into situations, we're hearing quite a bit where people are start to have symptoms, they test with an antigen test, which is half the time may not always be as accurate, although that increases probably 60% to 70% accurate. But they're testing themselves, they're negative, and they think, oh, well, I'm symptomatic, but maybe I'll still be able to go and visit so-and-so, or I'll still be able to go to work. They go to work, and then lo and behold, the next day, they repeat the test and they're positive. So I think we just have to continue to emphasize that a negative test is not a hallway pass. We've talked about that here before. So I think there's limitations on those antigen-based tests. They are one more layer of protection that we can use. We've talked about here how we really wanted to focus a lot of our distribution of our antigen tests to different sort of vulnerable sectors. We have 190,000 rapid screen tests from the federal stockpile delivered yesterday. So we've received a total so far this month from the Government of Canada, 295,000 tests, and are scheduled to receive another 186,000 tests from the federal stockpile in the next few days. We have, talked about before, you mentioned the daycares and early learning centers, schools. We've also have instituted that test to stay program with antigen-based tests. We've used it for the test or vaccinate program. We have a number of community organizations who've applied to Canadian Red Cross, Stop the Spread, Stay Safe program, and they're using, they'll help support nonprofits and charities to implement effective screening and reporting program for their staff, volunteers, and clients. There's a high demand for these tests, certainly across the country. So we're trying to make sure we work with our nonprofit sector to ensure they have access to the rapid tests. We've had 11 companies with a number of staff approved under the test to stay policy, and which allows asymptomatic individuals who are close contacts and essential workers to work isolate. It is, so a long answer, Tracy, to say that as soon as we are able to make sure that we have the antigen tests in places that we need them, we'll also be distributing. The next move is to try to distribute them to access P.E.I sites where we did have some, and we want to put more out there as soon as we're able to when our supply allows, so that others can access them.
Thanks very much.
Okay.
You mentioned about if people have a symptom, singular symptom, to be sure to go in and get tested at the clinic. I know yesterday both the Charlottetown and Summerside testing clinics had to close around 2 o'clock, a little early, or at least we got the news release around 2 o'clock because they were hitting capacity. What sorts of things are being done to avoid that happening on a regular basis? Are we thinking about putting up more pop-up clinics or adding lab capacity, anything like that?
Well, I mean, I think we've tried to address some of that in the last couple of weeks around making sure that those who are symptomatic and those who are close contacts or need confirmation of a rapid antigen test are primarily those who would go to a testing site. We are continuously looking at, what else can we do? Are there other ways of doing our testing and reporting it? It's very important, of course, testing is important, of a surveillance tool which allows us to sort of monitor what's going to happen or what could happen and the measures we need to put in place. I do think having 2 snowstorms 2 weekends back to back has been challenging, and that has and then the roads weren't great on Sunday. So there was, I'm not surprised there was extra demand yesterday. But we also know we're trying to make sure there's vaccine clinics, testing clinics, and health care capacity across the system. So we have also, for instance, we have EMS helping go into some of our long-term care facilities to do testing when they need to have testing. So we're trying to make sure there is testing available in those kind of situations. Always looking at what we can do within the human resource capacity restraints we have. And I don't know if you wanted to add anything to that, Premier.
I think you're doing a great job.
My last question, the 400 cases today, realizing that, of course, as you mentioned, the snowstorm had happened and more people would have been in yesterday getting tested. When we look at that per capita in this province, how concerned are you about that number?
Well, Tracy, I think what we've been trying to look at is not the numbers just on one day, but the trend over the last 7 days. And then really over the last 2 and 3 weeks as we look at Omicron. Certainly the number of cases are concerning, and so are the number of hospitalizations, and that half the people in the hospital at the moment that have COVID-19 that are being treated for COVID-19 are in the ICU, 4 out of the 8. So as well as the percent positivity. We know there's still good, lots of people getting tested, as you mentioned, but watching that percent positivity increase. So I think I've tried to mention in quite a few of those. So it's the number of cases that I'm concerned about today, but it's actually more than that. It's the other indicators and the trends of those indicators.
Thank you very much.
You're welcome.
Brittany Spencer, CBC. Hi, good afternoon to both of you. My first question, maybe you both can weigh in on. Premier King, you mentioned that you mentioned the modeling data that PEI is using to base your decisions around restrictions. When is that modeling data going to be shared publicly or made available?
Yeah, well, thanks, Brittany. And I guess, what I was referring to is, Dr. Morrison and Dr. Cameron come into my office and show me a number of different factors and indicators, whether or not that's the official modeling, so to speak. Maybe that wasn't the proper terminology, but they showed me a number of different, indicators that we have discussed here today, and the upward trend, not just in PEI, but where it is kind of per capita within the region and beyond, and which helps to inform our decision. But I think I would turn it over to Dr. Morrison to, clarify if that was actually modeling that I saw, or what the proper terminology might be.
Well, I think, I guess two parts of the answer there, Brittany. Certainly what we have been we look at all the time are the indicators, and we've mentioned quite a few here today, and we've looked at indicators throughout the pandemic, and they've had to evolve a little bit as well as we face different parts of this pandemic. But in addition to those indicators, we look at we always look every more than every week, but certainly weekly reports on our cases per capita relative to the rest of the country. We look at our hospitalizations per capita. We look at the modeling and the latest modeling from the country, from Canada, came out on Friday afternoon, and you may have looked at that, and certainly we've been following that, as well as some of the recent modeling coming out of the other provinces. We've been doing some of our own modeling here too, and hopefully that will be on the website. The modeling is one more tool, but it's really all the indicators that we're looking at, because they're telling us what's happening. The modeling is more about what could happen, and I think I said it here last time, so I'm going to repeat myself. It's the modeling is maybe useful about what could happen, but not what will happen. And but we'll as soon as that's available, we'll put that online and share that. We just only have so many people able to do all of this work, so some of it is just taking time to get up on the website too.
Okay, thank you. My next question is about ICU capacity. So we're now at 4 people currently being treated in the ICU. That's 4 of the 20 ICU beds the island has. How worried or how concerned are you that we could reach our capacity of ICU beds here on the island?
Well, I mean, I think that's why we're here today, to talk about all these measures. So that we don't exceed that ICU capacity, because we need it for people who may have COVID, who get really sick with COVID, but we also need the ICU capacity for many other reasons. If people here, our family and our loved ones and our neighbors need ICU admissions. So that's why these are not easy decisions. I mean, the Premier spoke about that, and he spoke about mixed emotions, and I think it's not even really mixed for us. It's really just gut-wrenching. I know I was hoping, the Premier was hoping, we all were hoping we wouldn't be in this situation. And but I think it's for that reason, Brittany, that you're mentioning, that we really, when we look at that trend of admissions, we look at that trend in the ICU, we need to do make these kinds of decisions now that may help us in the weeks ahead. This will not be long term, but it's what I think we need to do now. So I don't.
Yeah, and I would just add that, I was in conversation also with Dr. Gardam this morning just to get an update on kind of where we're at from a health P.E.I. operations perspective. And, obviously the number 4 is concerning. And it's especially concerning for the 4 families and individuals who are in there and we wish them well for sure. From an operation perspective, we're holding our own there. We're doing okay, but I think the fear or concern is the next 7 and 14 days and where we're at and what impact that we could have there. So I think Dr. Morrison is exactly right that we're here today with this news with the hope that we can do everything we can to keep that number as low as possible by limiting the contacts that we have as individuals with others. But I mean, from an operations perspective, the hospitals are doing okay and holding their own, but also holding their breath a little bit as to see what the overall impacts could be in the next, particularly the next 14 days.
Okay. My next question is about the new restrictions that go into effect at midnight. There were a lot of them, so forgive me if this was mentioned, but I didn't hear anything about places like salons, barbers. I know earlier in the pandemic we had restrictions or shutdowns in those types of facilities. Just wondering why no restrictions there this time.
Yeah. So thank you for that. What we are looking at as well is where, because we can look at the case data that we have, and unfortunately hundreds of cases, that the transmission doesn't appear to be happening in those kinds of settings. And so at this point we have continued to allow personal services, but not any sort of obviously, limiting the group activities and the organized gatherings, the personal gathering limits, but still making sure people can continue to get their personal services like their haircut. And so it's not the same as March of 2020. But we're trying to base it on the information we have about where the transmission is occurring.
Okay, thank you very much.
Kevin Brissett, Canadian Press.
Good afternoon. Dr. Morrison, I wonder if you could talk about Paxlovid, the new COVID treatment from Pfizer. How will you decide who will get it, and what's your plan for distribution?
Hi, Kevin. Thank you. So we have been sort of watching with anticipation the approval of this Paxlovid, which is an antiviral medication, and that should be used for those who have significant sort of underlying health conditions. It's not meant for treatment in hospital, but it's for early treatment fairly quickly after symptoms start. We are expecting delivery of 200 doses of this antiviral into the province for the following month. And so we've been meeting to try to finalize the details of that kind of distribution, Kevin, for P.E.I. And I think a lot of the provinces are doing the same thing, trying to finalize how to make sure it's equitably distributed to the people who need it the most in all parts of our community. So we have not finalized the process, but we hope to very, very shortly.
I wonder if maybe you and Dr. King or Premier King could talk about this, the fact that we know that COVID has been impacting staffing levels at the hospitals and the long-term care homes. Could you comment on how the island has been addressing that, and how people have sort of stepped up to make sure that those positions are filled?
Well, I guess I could start, Dr. Morrison, and hi, Kevin. I think we're, we've taken an all-hands-on-deck kind of approach to that, because we know there are short-term staffing challenges that many of our long-term care facilities are dealing with, for example. It started with getting nurses from the Department of Veterans Affairs to assist us with our vaccine clinics, and it was extended to those retired nurses and staff who were from the medical profession, who were at home, who came back to help. And we're also dealing with, it's not just a shortage in long-term care of nurses or RCWs or LPNs, but it's kitchen staff and cleaning staff. So we're really trying to just respond any way we can, and we put a call out to all sectors to pitch in and help. And we really hope it's a short-term thing, which we expect it will be. But the response has really been overwhelming, and it's not surprising to anyone from P.E.I. to know that people want to step up and help. And I think it's in the darkness and frustration of COVID, that's a shining light for P.E.I. and we're proud of that. But we've also been looking at. We talked on our First Minister's call about utilizing the Canadian military if need be. We have that, opportunity should we need it, and where we stand at the ready to do that. We've talked with Minister Dominic LeBlanc in his office to look at how that could be accessed if we need it. So we're really trying to take an all-hands-on-deck approach to that, and just really, really proud that Islanders have stepped up to the extent they can, but not the least bit surprised.
Thank you.
Allison or Julian have anything further? Or okay? Okay. All right. Well, listen, to our friends in the media, thank you very much, and to all Islanders, we just continue to appreciate your patience and understanding, and wish all to remain safe over these next couple of weeks, which will be certainly challenging, but thank you, Dr. Morrison.